Welcome to North Tees and Hartlepool Voices, telling the stories of our people and community in our trust.
My name's Ednick Kennedy, and today we go behind the scenes with
Lindsey Robertson, Chief Nurse. Hello.
Hello there. Why are we moving away from Datix?
We're moving to a more flexible system, so that's the first thing. Datix has stayed fairly static, and it hasn't really kept up with the national direction of travel. The bigger context of this really is how we capture events that happen across the organisation. So we used to call them incidents, but now we call them events, and it's all in line with the National Patient Safety Strategy. So we want to make it really, really easy for all of our staff to capture events where things might go well and things might not go so well, so that we ensure that we learn and we improve. And that's really the basis of why we're changing our system. InPhase is really flexible. Most young people, or most people across the organisation now, have apps on their phone. We're used to that. So this is an app-based system that sits in the cloud, wherever that is, and they can access those apps on any device that they've got, so they're not restricted to any of the computers that we've had previously. So it's much more flexible, easier. So when staff feel that there's something they want to share with us from a patient safety perspective or improving quality, then they can do it really easily.
So how long will it take to learn and embed?
So we've been learning for a little while. So there's a core team of us that have been doing this and driving it forward. There's quite a number of staff already being trained. But with anything, I think it's once we start to roll it out and we use it and we test it, and it'll evolve. So certainly the first phase of rollout will be for our events, which our staff will understand as Datix incidents, how they report, so we'll call them events. And that'll be the first app to roll out in December. So there's lots of training around that, and then we'll follow on with complaints and compliments and risk. So we're moving that as a rolling programme.
So what's the main advantages of implementation in phase?
I think I've probably said a bit of that in a very hurried way. So I think the main advantage is that it is really accessible. I think previously there's only been one system. People have to sit down, they have to do it, they have to get to a desktop computer. This means that they can do it from their phone. It's really easy, like anything. Like if you were buying something on your phone, it's very easy to access, as it's a cloud-based system. So any piece of technology they can do. And if people can't get to the technology, we can support them with some paper if they need to do that.
We have clear points and contact, support and training and advice.
Yeah, we've got some what we would call super users. We're going to have those across all the departments. We're going to make it really easy for those staff who are frontline, so they can go and get some support from the teams, understanding it and rolling it out. But not just around training that they have to access online, but we'll be there walking the walk with them, so that we can really get underneath it and support any of those things that we probably haven't predicted, but we can do at the time.
So the rollout plan will be phased.
Yeah.
How do you plan for that?
So we've already got that happening. So we've done quite a lot of training now. I think there's been circa 130 people trained on some of the app-based stuff already. Got a dedicated team. We're going to have computers and any technology set up in the back of the restaurant, but we'll be walking the floor. So when we roll it out, we'll go to the areas where people are using it and we'll be with them on site.
And the planned rollout is to end in March?
Yeah, this year. Datix will go at the end of December. So we're on a tight deadline. People have been working really hard to make sure that we get those first apps in use, and then we'll have it all in place by the end of March.
Okay, thank you.
Thank you.
Thank you for joining us. Till next time, you've been listening to NTH Voices.